Following our initial definition of anatomy, we move to the taxonomy of anatomical study. To effectively engineer solutions for the human body, we must first categorize how we analyze these structures. This brings us into the realm of gross anatomy, also known as macroscopic anatomy. Gross anatomy is the study of body structures visible without the aid of a microscope. It encompasses the hardware of the human system, the organs, bones, muscles, joints, and vessels that occupy distinct body regions. Within this field, we utilize for specific subdivisions to organize our technical analysis. 1. Regional anatomy. Regional anatomy focuses on the organization of the body by specific areas, such as the head, thorax, or upper limbs. In this approach, we examine all structures within that compartment simultaneously to understand their spatial relationships. Example: when studying the forearm, you analyze the radius and ulna, the overlying muscle groups, the nerves, and the vascular supply as a single, spatially related unit. For an engineer, this is essential for understanding how local components interact within a tight geometric envelope. 2. Systemic anatomy. Systemic anatomy organizes the body into functional organ systems. This is the approach we are primarily utilizing in this series. Example: we look at the skeletal system as a whole, then the muscular system, followed by the nervous and cardiovascular systems. This allows us to track a specific functional logic such as load-bearing or signal transmission across the entire human frame. 3. Surface anatomy. This subdivision examines external anatomical landmarks and their direct relation to the deeper structures they overlie. Example: identifying the bony prominences of the elbow or the palpable tendons of the wrist. In engineering and clinical applications, this is the user interface of the body. It is how we accurately locate internal structures for medical imaging or the placement of external rehabilitative sensors without invasive procedures. 4. Functional anatomy. Functional anatomy is the bridge between static structure and dynamic performance. It relates anatomical form directly to movement, mechanical behavior, and physiological function. Example: instead of just naming a bone like the humerus, we analyze it as a lever and examine how its shape at the shoulder joint determines the range of motion. This is the core of biomechanics, understanding how the structural design of the component dictates the mechanical output and efficiency of the entire system. By establishing these taxonomic subdivisions, we have the organizational framework required to transition from general study into the specific systems of the locomotor apparatus.